And we've made progress. In some age groups, we've seen declines in obesity. New York City, through a comprehensive approach, has rigorously documented in hundreds of thousands of school kids a decrease in obesity of 6%, actually a decrease of 10% in the younger age groups. We're not sure what caused that, but we are seeing progress in various jurisdictions around the country. And E. coli 0157 infections decreased by half in the past 14 years through a collaboration with industry and public health. Healthcare-associated infections affect 1 in 20 hospitalized patients. They cost about $30 billion a year. And if you look at just one particular problem, Clostridium difficile, which we recently published an update on, nearly all infections are from the healthcare setting, and about 14,000 Americans die each year as a result of complications of C. difficile. And yet we're seeing real progress with steady declines in central line infections and other infections. So again, a winnable battle, an area where we can make a difference. Motor vehicle injuries, 33,000 deaths a year, 3 million ED visits a year, the #1 cause of injury death and the #1 cause of death in Americans age 1 to 45. $100 billion in healthcare and economic costs, but we have made progress. Nearly a 25% decline over the past few years in motor vehicle fatalities through a wide variety of efforts, including expansion of ignition interlock devices and expansion of graduated driver's licenses, making it safer for kids to learn to drive without endangering themselves, their friends, and other drivers and pedestrians. Teen pregnancy. 1,000 teens give birth every day in this country. 1 out of 11 new mothers is a teen. Our rate of teen pregnancy is 9 times higher than the rate of other countries. And the cost to taxpayers is about $9 billion every year. And more than that, teen pregnancy condemns the next generation to not living up to their full potential and represents often the intergenerational transmission of poverty. We are seeing progress, not nearly enough, but progress with a 17% drop in teen pregnancy in recent years. So these are areas where we're making progress and we can make much more progress. HIV. We still have 1.2 million people living with HIV, and 1 in 5 of them don't know they're infected. Only about 1 in 4, 28% of people with HIV have their viral load suppressed. That means that nearly 3 out of 4 are not getting effective treatment. And the virus is raging through their body, destroying their immune system, increasing their risk of cancer, and increasing their risk of infecting their partners, their families, and their communities. The lifetime cost of caring for one person with HIV is $400,000. You can buy a lot of condoms for $400,000 to prevent HIV. We are making some progress. 11 million more Americans know their status than knew it just a few years ago. And we need to make even more progress helping people learn their status and get into care and stay in care. Heart disease and stroke are leading killers in the U.S. There are 2 million heart attacks and strokes per year in this country, 700,000 deaths per year from heart attack and stroke. 1 in 3 deaths is from heart attack or stroke, many of them in younger individuals. And the conditions are costly, about $444 billion a year in healthcare and economic costs. There's a lot that we can do to reduce cardiovascular disease, and that's why last year, in conjunction with the Center for Medicare and Medicaid Services, we launched the Million Hearts campaign. We think we can prevent 1 million heart attacks and strokes in the next 5 years, now 4 years, with very focused interventions. What we can do is, on the one hand, to reduce the need for care through tobacco control interventions, improvements in diet and nutrition, such as the elimination of trans fat and reduction of sodium, and by improving care of people who are in need of care for high blood pressure and high cholesterol. And I think the several ways we've seen of improving clinical care involve first and foremost looking at the numbers, getting everyone to focus on key outcome indicators. What proportion of your patients have their blood pressure controlled? We want every doctor, nurse practitioner, advanced practice nurse in America to know the answer to that question. Whether they're an obstetrician, an orthopedist, a primary care practitioner, to know what proportion of their patients have their blood pressure under control, because right now nationally, it's at 46%. And even for people in care, it's not much over 60%. But the best performing health systems can get it up to 85 to 90%. That difference is the difference between 2 million heart attacks and strokes a year and 1.5 million heart attacks and strokes a year. It's 500,000 Americans. If you think back to that person you thought of at the very beginning with a heart attack or stroke, who don't have to have a heart attack or stroke. The second major initiative in clinical care is health information technology. We're still in the dark ages, but we're rapidly emerging from them. We're rapidly able to increase availability of information before the visit, during the visit, and after the visit, not just for the doctor, but for the entire healthcare team that has a role in patient care and a right to have that information, and for the patient, because we need to free up that information. As patients, why shouldn't you own your healthcare data? And third, clinical innovations. We know that there's only one solution to the following problem. How do you improve the quality of care, reduce expenditures, and preserve employment? There's only one answer to that challenge. You use a broader healthcare team where every member of the team is used to their fullest potential, to the limit of their license, so they're practicing at the top of their competencies, not at the bottom. So you have the physician as quarterback, point guard, if you will, since we're in Kentucky. You make sure that there's optimal use of all members of the team. We think that with this focus, we can reduce by 4 million the number of people who smoke and increase by 10 million the number of Americans whose blood pressure is under control. Those are measurable numbers that are going to require laser-like focus. Most of the work in tobacco control will be done in communities. Most of the work of hypertension control will be done in clinical settings. In tobacco control, we have things like hard-hitting ads, pricing of tobacco, smoke-free air, comprehensive programs. They work, and communities that implement them see their healthcare costs fall. They see their smoking rates fall. In the clinical sphere, we have blood pressure control and the potential to make a huge difference with reducing strokes, heart attacks, dialysis, kidney failure, eye problems, and a host of other health problems that come from high blood pressure. I also want to mention the epidemic of prescription drug overdose. Prescription opioids now kill more people than heroin and cocaine combined. 15,000 people a year. More emergency department visits than heroin and cocaine combined. There's been a 5-fold rise in the number of deaths in the past 20 years and a 10-fold deaths in the number of prescriptions. In fact, enough opiates are prescribed each year to give every adult in America opiates every 4 hours around the clock for a month. This is a major problem. And we think we can do a lot about it. It's costly, but improving clinical practice, increasing access to substance abuse treatment, strengthening prescription drug monitoring programs, which your Congressman Hal Rogers has been instrumental in helping to create across the country, implementing patient review and restriction programs, leveraging insurer and pharmacy benefit managers, and enforcing laws, policies, and regulations can make a really big difference.